All right. Happy Monday morning, students. Let's get into our first lecture. So I'm going to share my screen, and this is the PowerPoint presentation that's already included inside of your announcements. So I'm going to do a walkthrough. This is the one that accompanies your weekly study guide. This is specific to radiology. All right, so let's get started here. All right, so question number one on your study guide. What is a quadrant and what is a cavity? So a quadrant, think of quad like four, right? A quadrant is a body structure that is divided by four. So we have four quadrants. We have a right and left upper quadrant, and we have a right and left lower quadrant. The abbreviations have also been included. So this is usually, like I call it shorthand, but this is how you would usually see each quadrant represented in like a surgical note or an operative note. It would be abbreviated RUQ, LUQ, RLQ, or LLQ. And you can stop these videos, stop and start them at any point. The great thing about being online, right, is this is pre-recorded and you have the opportunity to repeat it and replay it as many times as you need to. Let's move on to the next slide. The question is, what is the opposite of internal? Well, the opposite of internal is external. So to put it in terms of medical terminology, uh, external would be situated or occurring on the outside. In anatomy, situated or toward or near the outside would be external. Also think of internal like in external as in what can be seen by others, right? And what can be only perceived by the patient or felt by the patient, right? So externally, a physician could see signs of a patient's distress, right? Or a patient's condition. Let's say just by the color of their, the tone of their skin. Like if they were lacking oxygen, it would be blue. If they had they had an increase in their bilirubins and they could become jaundiced, right? So their skin would have a yellow pallor to it. So those would be external signs, right? And think about internal would be symptoms also, right? Patients, what they're experiencing on the inside can't be seen or perceived by others. So internally, I'm feeling sick to my stomach, or internally, I have a pain in my lower left quadrant, right? That's not something that the physician can physically see, but based off of the patient's description of where that pain or that sensation or whatever is occurring within the body internally, right? The doctor would then have an idea of where they would want to, focus their diagnostics on, right? So depending on the quadrant also depends on what organs are located within those quadrants. Next slide. All right, let's talk about what therapeutic is. So therapeutic is an action from therapy or a medicine that results in the improvement of the symptoms and signs of a disease. We were just talking about signs and symptoms. An example of a therapeutic medication would be a therapeutic steroid. So, inhaled as a aerosol spray, this can relieve symptoms of chronic bronchitis. That is an example of a therapeutic medication. Next slide. The question is define terminal. So, terminal or a terminal condition is one that is life limiting. So, a terminal condition, it is expected that the illness will result in permanent unconsciousness from which the person is unlikely to recover. So, a terminal condition or illness is one that is life limiting. Next slide. Let's talk about chronic. Define chronic. So, a chronic disease has symptoms and signs that continue for 3 months or longer. I use the example of chronic bronchitis. So, again, in order to be a chronic condition, the patient must experience symptoms and signs longer than or 3 months or longer. Next slide. Define infectious. So, infectious diseases are disorders caused by organisms such as bacteria, viruses, fungi, or parasites. I've listed some common infectious diseases such as coronavirus or COVID-19, diphtheria, Ebola, influenza, or commonly known as the flu, hepatitis. There's multiple types of hepatitis. HPV, that would be your human papillomavirus, HIV, meningococcal disease, norovirus, pneumococcal disease, and the rotavirus, just to name a few. So, infectious diseases are disorders caused by organisms. And those organisms can be bacterias, viruses, fungi, or parasites. All right, next slide. A patient who shows no symptoms or signs is called asymptomatic. All right, let's make this your first introduction into medical terminology. The prefix a, just the prefix, the letter A, means without. Okay, so now you have a asymptomatic patient. So asymptomatic means without symptoms. So this means a person can be infected with a pathogen, but displays no signs or symptoms. So remember, we talked about signs and symptoms. Symptoms is what a patient experiences internally, right? That cannot be seen or from the outside or observed externally, whereas signs are can be observed or seen externally. So think about signs like sweating or the color of a patient's skin. Those are some, or even a cough, right? That would be a sign. Fun facts, just a little bonus here. Mary Mallon. She was known as Typhoid Mary. She was the first person in the United States identified as an asymptomatic carrier of a pathogen associated with typhoid fever. She was presumed to have infected 51 people, 3 of whom died over the course of her career as a cook. If we wanted to bring it into the 20th century, something more modern, think about COVID, right? So we discovered that some patients had no signs and symptoms and they were just carriers. So asymptomatic, a person that has been infected with a pathogen but displays no signs or symptoms. All right, next up, the question is, what is the difference between degenerative and congenital diseases? So, degenerative disease is caused by the progressive destruction of cells due to a disease or the aging process. So, degenerative diseases are classified into three main groups, and this is bonus information, not applicable to your theory quiz, just additional information. Degenerative diseases are classified into three main groups: cardiovascular, neoplastic, and nervous system. That doesn't mean there isn't more, but they are classified into three main groups. So I also gave some examples. So hypertensive disease, hypertension, that would be a cardiovascular degenerative disease. Parkinson's, Alzheimer's, tumors, cancers. So degenerative disease is caused by the progressive destruction of cells. And this is due to either a disease or the aging process. Now let's talk congenital. So diseases are caused by an abnormality in the fetus as it develops, or it could also be by an abnormal process that occurs during gestation or birth. Some examples of congenital diseases are cleft palate, Down syndrome, spina bifida, club foot. Bonus fun fact, guys, this goes along with coding. Congenital diseases, they are coded from your ICD-10 manual, and the first letter, the letter that represents congenital conditions, all congenital conditions, is the letter Q. The letter Q. So Q codes represent congenital conditions. And you can go into your ICD-10 manual and check that out. All right, up next, the question is number 9, define etiology. All right, another word breakdown. So, etio is causation. Ology is the scientific study of something. So put it all together. Etiology is the cause or origin of a disease. The word etiology comes from Greek. You'll find that most of your medical terms have a Latin or Greek derivative. So cause or origin of a disease, and the study of the cause or origin of that disease, right? The ology. So ology, notice the dash before the letter O, that means it's a suffix. The dash after the O in etio represents and tells you this is a prefix. Put it all together, etio and ology, and you've got etiology. All right, up next, let's talk about what a disease is. A disease is any deviation from a normal structure or function in the body that interrupts or modifies the performance of vital functions. This is termed a disease. Any deviation from a normal structure or function. So think about when the body is in balance and we call this homeostasis, right? When there's nothing wrong, right, in the body, there's nothing interrupting or modifying the performance of the vital functions. We would call this the body in what we call balance or homeostasis. And when it's out of balance, this would be indicative that there is some type of disease that is deviating from the normal structure function of the body. So this could be anything from the flu, right? A common cold, a fractured bone, a staph infection, right? All of those are diseases. And diseases will be coded from your ICD-10 CM manual. Up next, what structure can only be seen through a microscope? That is going to be cells and cellular structures. Cells and cellular structures can only be seen through a microscope. All right, up next, let's talk about body cavities. So the question says, define the 5 body cavities that are continuous with each other and the one body cavity that stands alone. So first, let's talk about what a body cavity is. A body cavity is a hollow space that is surrounded by bone. First up are continuous cavities. So your continuous cavities are your cranial and your vertebral cavity. There's 4 total. 2 are on this slide, 2 are on my next slide. So the cranial cavity contains the brain. The vertebral cavity contains the spinal cord, which is an extension of the brain. These 2 cavities combined are also referred to as the dorsal body cavity. So another introduction to a key term. So dorsal would be the backside. Think about like a dorsal fin on a dolphin. So that's on the backside or on their back. Two additional continuous body cavities are going to be the abdominal and pelvic cavity. Combined, we call this the abdominopelvic cavity or region. We were talking about your right and left upper and lower quadrants. This is a great example of how, depending on where the patient is pointing of where their pain is occurring at, right, will determine how the physician choose to direct their focus on how to manage the problem. So your abdominal pelvic cavity contains your stomach, your liver, your gallbladder, your pancreas, your spleen, your some of your large intestine, your rectum, your urinary bladder, and your internal reproductive organs. So depending on the quadrant, right, depending on where that patient points to where the pain is going to will determine what organs or what could potentially be wrong based on the organs that reside within that particular quadrant. Now our standalone, the thoracic. So your thoracic cavity contains your trachea, your bronchi, your lungs, your esophagus, your heart, your great blood vessels, your thymus gland, your lymph nodes, and nerves. One of the most important nerves related to respiration would be your phrenic nerve. You may be asking yourself, well, what are those pleural cavities? So pleural cavities is what surrounds each lung. All right, let's get into some body planes. So the next question is, what are the three planes of the body and how do they divide the body? All right, so let's start with first up is the coronal plane. This is sometimes also referred to as the frontal plane. So your frontal or coronal plane separates the body into front and back parts. Medical terminology, anterior, posterior. Anterior is the front, posterior is the back. So the coronal plane separates the body into front and back parts. Up next is the mid-sagittal plane. So just think midline or middle, right? So this is a vertical plane and it divides the body into equal right and left halves. Mid-sagittal. Lastly is your transverse plane. The transverse plane runs from side to side, so horizontal, and divides your body into top and bottom halves. Transverse plane. It's your horizontal plane. Up next, there are two of the imaginary planes that divide the body, derive their names from suture lines in the skull. As you can see on my slide here, there is a sagittal suture. You can see how that one's running right down the midline of the skull. So think mid-sagittal as a body plane, and it's also derived from the suture line in the skull called the sagittal suture line. And then you'll also notice you've got a coronal suture. So these are the two suture lines in the skull. And the imaginary planes that derive their names from these suture lines. So again, coronal and sagittal suture. All right, up next, the question is, what is the difference between anatomy and physiology? Anatomy studies the structure of organs and cells of the human body. Physiology is the study of the function and workings of organs and cell structures in the human body. So anatomy equals structure, physiology equals function. All right, up next, describe the human body in the anatomical position. So the body standing erect, the head is up with the eyes looking forward. The arms are by the sides with the palms facing forward, and the legs are straight with the toes pointing forward. This is the anatomical position. All right. Define abbreviations. We just talked about this earlier. Your RUQs, your RLQs, your LUQs, and your LLQs. So RUQ, right upper quadrant, RLQ, right lower quadrant, LUQ, left upper quadrant, and LLQ, left lower quadrant. All right. The next question is, what are the 7 different approaches for studying the human body? So the 7 organizational approaches to studying the human body are by body planes and directions, by body cavities, quadrants, regions, and areas, anatomy and physiology, micro to macroscopic, by body systems, and medical specialties. These are the 7 organizational approaches to studying the human body. All right, let's talk about so we talked about quadrants. Now we're going to talk about regions of the abdominopelvic area. So you have a total of 9 regions. Remember, 4 quadrants, 9 regions. And as you can see, we were just talking about earlier how you've got different organs within different quadrants. Now we're even expanding further. We've got different organs in different regions, right? So if we're looking at this example here, your right and left hypochondriac regions. On the right side, this includes your liver, your right kidney, your gallbladder, and some of your large and small intestine. Your epigastric region also includes your liver. This includes your stomach, your spleen, your duodenum, which is the first part of your small intestine. It includes your adrenal glands. And the reason that your adrenal glands are housed in your epigastric region is they actually sit on top of your kidneys like a little cap. And your pancreas is also part of your epigastric region. On the left side, you've got the liver's tip. Still have some of the stomach, pancreas, left kidney, spleen, and large and small intestines. Your right lumbar region includes the ascending colon, which is part of your large intestine. It still includes your small intestine and includes your right kidney. Umbilical region includes duodenum, transverse colon. Your transverse colon is part of your large intestine. Left lumbar region, descending colon, again, large intestine. Still includes some of the small intestine as well, and your left kidney. In the right iliac region, you've got your appendix, your cecum being your large intestine or a part of it, your ascending colon, and some more intestines. Your hypogastric region include your bladder, your sigmoid colon, which is part of your large intestine. And this is where also your reproductive organs are in your hypogastric region, so below the stomach. Left iliac region, this is going to include your sigmoid and your descending colon, which is both parts of your large intestine, and still some of the small intestines. It's all kind of just squished in there. So it's easier to break down, right, when you separate into quadrants and regions. So if a patient was to come into an urgent care or an emergency department, right, and grabbing maybe their lower, lower right abdominal region, or the right iliac region, the physician may automatically, based off of what the patient's symptoms and signs are, think maybe we've got a problem with the patient's appendix, right? If the patient comes in and they're holding like the front upper left region, I'm experiencing a lot of pain. Oh, it hurts. I'm doubled over. Maybe it's the patient's spleen is ruptured, right? So again, that's how the doctor determines, and even a radiologist, right? Well, where is the region? Where is the pain, or where is the concern focused at? What region? And then that's the part that they're going to do an ultrasound on, or an MRI, or even make a surgical opening, right? Depending on where that pain is occurring at, what region or quadrant. All right, let's talk about signs and symptoms. We've been talking about this. So now we got official definitions. A symptom is any deviation from health that can only be perceived or felt by the patient. So symptoms of I'm nauseous or I'm dizzy, right? That can't be seen from the outside or externally. Where a sign, right, has a physical manifestation, whether it's sweating, or my temperature's gone up, or my pulse rate is increased, right? These things can be detected by others. So when a symptom has a physical manifestation, it is known as a sign. So a sign is something that can be observed externally, while a symptom is felt internally. All right. Next question. What is the predicted outcome of a disease called? This is called a prognosis. Prognosis. The predicted outcome of a disease. All righty. Next up. Know what these specialties study. So let's talk about first what a specialist is. A specialist physician is a doctor who's completed advanced education and training in a specific field of medicine. So when you're thinking about your CPT books, they're divided into anatomic sites, right? But there is a specialist that focuses on each one of those anatomic sites: integumentary, musculoskeletal, digestive, uh, you know, um, digestive would be like a gastroenterologist. So even though we're introducing you to this whole manual, by the time you get out into the real world, right, you're going to be working with a physician that focuses on one of these body systems, and that is their specialty. So let's talk about some of these specialties. Orthopedist. So orthopedists literally translate to straightening bones. So they specialize in treating conditions of the bones. An ophthalmologist, right? So ophtho is going to be eyes. Geriatricians. So these are primary care doctors that have additional training in treating and managing the health of adults 65 and up. An oncologist, this would be a physician that specializes in treating patients with cancer. Your gastroenterologist, these are specialists who treat patients with digestive and accessory organ diseases. Next up, what is the opposite of acute? The opposite of acute is chronic. So think about earlier when we were talking about chronic bronchitis, right? So the opposite of acute is chronic. An acute illness generally develops suddenly, lasts a short period of time, typically only a few days, maybe a few weeks, whereas chronic conditions develop slowly and may even worsen over an extended period of time, from months to years. Remember that standard is 3 months, represents a chronic condition, 3 months or longer. All right. Next question. Who are physician extenders? So I also want you to think about physician extenders as qualified healthcare professionals. Okay. So not everyone is a doctor, right? But they can still perform the same types of medical activities that a physician could perform. So they can still, write prescriptions and manage and evaluate patients. So a PA, that is a physician assistant, nurse practitioners, also termed NPs, a nurse midwife would also be a physician extender. Certified registered nurse anesthetists, or what we call CRNAs. So they can administer anesthesia without being a anesthesiologist. So these are physician extenders, healthcare providers who are not physicians, but can still perform medical activities typically performed by a physician. So little extra here, your nurse practitioners, they can actually open up their own family practices and function independently. Whereas a physician assistant is still under or overseen by a medical director. Also, physician assistants, this is going to depend on the state, but just speaking for the states that I'm familiar with working in, which is California and Nevada, there are some restrictions on the type of medications that can be prescribed by a physician assistant, and sometimes they need that secondary signature by the medical director, before that, certain tiered or controlled substances. Where a nurse practitioner, they can prescribe any type of tiered or controlled medication. When I worked for a gastroenterologist, he performed colonoscopies and endoscopies. He had a surgical suite right next door to his main practice, and he had a CRNA. And she was the one that would anesthetize all the patients and prep them for their colonoscopies. All right, up next, the question is define sequela. So a sequela, this is an abnormal condition or complication that arises because of the original disease. And it also remains after the original disease has resolved. I like to use the example of a scar. That is a very common sequela, right? So in this image, it looks like this patient likely had some type of a tracheostomy, right? And which was supporting her in being able to breathe until she was able to breathe on her own. So once she was able to breathe on her own, right, that original condition or disease had resolved itself, closed up the tracheostomy, but then the patient had a scar that remained after that original condition had resolved itself. So a sequela, that's what we call that. All right, last one here. What healthcare setting is the most frequently used setting? That's going to be the physician's office. This is also why in your CPT manual, the very first code set in that book is evaluation and management. Everything starts with that initiated, decisions for how that patient's health or condition is going to be managed. all starts with an encounter with a physician. So that is why your evaluation and management codes are at the very beginning of your CPT code set, and why the physician's office is the most frequently used healthcare setting. Recommended videos. Some of these videos I've already included inside of your announcements. I don't play the videos in my pre-recorded lectures. For some reason, it just feels like the videos seem to lag when they're streaming from YouTube. So please, again, take that initiative for additional, understanding of these concepts by reviewing those bonus videos. All right, that's it for this lecture. More to come. I'm going to do a coding video next. See you in the next episode. And welcome to your week 1.